Heart diseases are the leading cause of the death worldwide. According to the World Health Organization, 17.9 million people died in 2019 because of the cardiovascular diseases, and it represents about 32% of the death globally. One of the main cause of the heart disease is dyslipidemia. Dyslipidemia is the condition in which unhealthy level of the lipids are increased, either one or more than one type of the lipids are increased in the blood. Types of the lipids in the blood are cholesterol, triglyceride, LDL, the low density lipoprotein, it is called the bad cholesterol, and HDL, high density lipoprotein, it is called the good cholesterol. So dyslipidemia or cholesterol increases with the age and dietary habits. LDL or bad cholesterol causes the atherosclerosis, hardening and thickening of the coronary arteries. If it remains higher than the reference range for the longer time, it causes the atherosclerosis and it blocks the coronary vessels and causes the heart attack. Screening is the best tool for the prevention of the heart diseases. So screening should be started at the age of 40 years if there is no any other risk factors. In the healthy people, screening for the lipid profile test should be conducted once a year and should be started at the age of 40 years. If someone have the risk factors, for example, family history of the hypercholesterolemia or diabetes or hypertension or obesity, sedentary lifestyle, and a diet include the more saturated fat. So in these risk factors, the screening should be conducted 10 years before. So in the healthy people, screening for the lipid profile should be started at the age of 40 years and should be repeated every year once. But if there are risk factors, so screening should be conducted 10 years before, is at the age of 30 years. If there is a history of familial hypercholesterolemia, this is a congenital stage in which the cholesterol level start increasing from the childhood. The condition is called familial hypercholesterolemia. In this condition, the screening should be conducted at the age of 20 years for the prevention of the heart diseases. Management of the dyslipidemia is lifestyle modification and medications. In the lifestyle modification, exercise and diet. Exercise is recommended 30 minutes daily for the 5 days. Aerobic, moderate intensity exercise that increase the heart rate and the breathing rate, and it will help to reduce the triglyceride and LDL level and increase the HDL level. In the diet, high fiber, for example, vegetables and fruit consumption helps to reduce the cholesterol level. and low saturated or restriction of the saturated and trans fat that's mostly present in the red meat, butter, ghee, margarine. So we should reduce the intake of the saturated fat and trans fat. It will help to reduce the level of the LDL. First step of the lifestyle modification that help to reduce the level of the dyslipidemia or reduce the total cholesterol and LDL. If there is a no response for the continuously 6 months, 3 to 6 months, we have to continue the diet and exercise. If there is no response or the LDL level is still higher than the reference range, then statin, the medicine that reduce the cholesterol level, should be started with the discussion of the doctor to prevent the heart diseases. Many people ask this question that we have reduced the saturated fat in the cholesterol food in the diet, and we have also continued our exercise for more than 6 months, but still the level of the cholesterol and LDL is high. So there are the two type of the cholesterol. So one is the endogenous cholesterol that is synthesized by the liver, and one is the exogenous cholesterol that we take in the diet. So we reduce the intake the diet or we restrict the diet of the cholesterol and saturated fat, but inside the body, liver is synthesize the cholesterol more. So some of the genetical condition in which the liver synthesize the cholesterol more. So in familial hypercholesterolemia or in genetical diseases, or someone have the family history of hypercholesterolemia. So in this condition, better to discuss the doctor and start the statin cholesterol lowering medicine that will help to reduce the cholesterol level and LDL level, and it will help in the prevention of the atherosclerosis and heart disease in the future. For the prevention of the heart diseases, we have to decrease the low density lipoprotein that is called the bad cholesterol and increase the HDL, high density lipoprotein, that is a good cholesterol. So we can reduce the low density lipoprotein with a lifestyle modification, exercise, and reduce the intake of saturated fat and trans fat in the diet. So diet can help to reduce the level of bad cholesterol, restriction of the saturated fat and trans fat, red meat, ghee, butter, margarine, and increase the level of HDL, high density lipoprotein, the good cholesterol. So we can increase with the exercise and with the intake of the amount of nuts, walnut, almond, fish oil, omega-3. So these are the good for the heart. Thank you.